year PhD student now at the University of Winchester, and I am designing an intervention to improve the well-being of student nurses. Let's see if this will work. So I am very keen on sort of positionality and reflexivity. So I thought I would just sort of give my background. So I started my career as a healthcare support worker. I worked in elderly care, so that was rehabilitation and end-of-life care, and I absolutely loved that. I then went on to do dual field child and adult nursing at the University of Southampton, and that is me in my very fetching student nurse outfit. I then went to Surrey to do a master's in psychology conversion before coming to Winchester to do my PhD. So my PhD is hoping to answer the question, what are the necessary components of an intervention designed to improve student nurse wellbeing? So to me, the justification for this is that top line. So student nurses report poor wellbeing. And in my opinion, that should be sufficient justification as to why we should be exploring this. I really don't think any individual should be impacted by their course or their job. So if they're telling us that they are experiencing some difficulties, we really should try and solve that. However, we do also have high rates of student attrition. So we have up to 35% of students who start the course won't actually go on to finish the course. And I'm sure you are all aware we are in the middle of a huge nursing crisis. The vacancy rate is absolutely phenomenal. And so if we're having not many students coming in, that is just going to escalate. So this is quite a studied area already, but many of the previous approaches have been top down. So they've gone in and said, this is an intervention that's going to work. I'm not against that type of study. However, I think the amount of data we now have on including those who intervention is aimed to help within the whole process really highlights how important it is to make sure that stakeholders have design of interventions. And like with many areas, there are methodological limitations, for example, a lack of long-term follow-up or poor designs in terms of randomization. So going into my PhD, my priorities were stakeholder involvement, reflexivity, ensuring that I was theory informed, and considering the mechanism of action of any intervention that I was going to propose. So this brings me on to my two friends, epistemology and ontology, which I'm sure many of you are aware of and have grappled with. To give a really, really simplistic overview, just in case people aren't aware, ontology is about what you think of reality, so what exists in reality. For example, do we construct reality or does it exist mind independent of us? And epistemology, so how do we know? For example, if there is a mind independent reality, can we measure that objectively, or are we always going to be working within a sort of relativist framework? So I grappled with these 4 months, and my poor supervisors, I think, were tearing their hair out. But I eventually settled on critical realism. So this is a paradigm that has been defined as, I suppose, or said to be ontologically bold and epistemologically cautious. So it says there is a stratified ontology. So by that, it posits there is a part of reality that we can see and we can objectively measure, but there is also a part that we can't see. And this is what it means by a relativist epistemology. But this is a really great paradigm if you're looking at interventions, because rather than just looking at a pre and post measure, it considers what works for whom in what circumstances and why, and it creates context, mechanism and outcome configurations. So it looks at what the context is that an intervention is being implemented into, it considers the mechanism through which it's having an effect, and then it looks at the outcome. And this is using a process of abduction. So rather than just focusing on empirical observations or just on theory, it's intertwining the two in a really creative way. So my method kind of has 4 key components to it. So I've got theory, I've got my systematic review, which has just been published, very exciting, and I'm doing my case study. And I've just started getting some stakeholder feedback on one of the interventions I've designed. Today, I'm just focusing on my case study. However, I'm going to give you the very, very overview results of my systematic review, which you can ask me more about after if you want to know more. So I was looking at the effectiveness of interventions and behaviour change techniques to reduce stress in student nurses. So behaviour change techniques are the smallest component of an intervention that are observable, replicable, irreducible, and designed to change behaviour. The fact I can remember that is shows how many times I've read it and said it. So I found that many of the interventions were aiming to improve students' ability to cope with stress, and most were targeting coping by providing students with instruction, demonstration, and the skills to adopt a specific behaviour. For example, mindfulness. The reason I've put we need more well-conducted and reported evidence is because I feel like this is an outcome that is quite frustrating as an author. You kind of feel like you want to produce more than that, but the fact is you can only work with the evidence you have, and many of the studies had several methodological limitations. Very few were based on theory, which meant it was really hard for me to really look at how these interventions were actually influencing the outcomes they were measuring. So this was the bit I really wanted to focus on because this is my passion. It's looking at the voice of students and their educators and finding out what all these concepts mean to them. So I was aiming to find out what well-being meant to students and their educators, what factors influenced their well-being, and which interventions are seen as being beneficial. So my case study was in one university in the south of England. I did a questionnaire with 45 students, and in this I was exploring things such as how students' professional identity influenced their well-being and whether the clinical academic split, so spending part of their time in university and part of their time in the practice setting, if that influenced their well-being. I also conducted validation interviews with 2 students and interviews with 1 supervisor. So they are supporting students within the practice setting, and 1 academic. So they're supporting students in the academic setting. This wasn't my initial method, but COVID got in the way. And so I was hoping to do focus groups, and the poor students were just so stressed. In the end, I was thinking, my PhD is hoping to reduce their stress. I don't want to be adding to it. So what did I find? Well, as with many of the definitions of well-being we get, there were 5 key themes that really came up for me. So firstly, well-being was seen as a holistic construct. So a lot of people were saying it's physical, psychological, emotional, even economic well-being came up in that. It was an individual concept, so it would vary between person to person. A lot of students talked about being content, and that's content as in happiness. They all spoke about having their needs met, both by themselves and by others, and the concept of balance came up, and this was both related to managing the demands and having stability in their lives. In terms of the factors that influenced well-being, I identified 3 themes, so I'm going to go through them one by one. I should say that I was asking questions about identity, and I was asking questions about the practice-academic split, so that is likely to have influenced the themes I've come up with. However, I was trying to be reflexive and not analyse question by question, but analyse as a whole. So students were telling me that they don't know who they are as professionals yet. And this had a great impact on how they viewed their identity as a student nurse. So there were 2 sub-themes within this. The first was judgment, and students were saying that they felt as student nurses, they were constantly being judged. They felt they couldn't relax on placement, they felt they couldn't be themselves, and that's related to authenticity. So some students may not act their true identity. And I think true identity to them meant being who they were. It came out that it was sort of related to their personality as opposed to the person they thought they should be as a student. And I think when you are a student nurse, for example, when I was in practice, I might do 3 long days in A&E, and they can be from 7 a.m. till 9 p.m. You might get minimal breaks. You are seeing birth to death to everything in between. And so if for all of those hours you feel you can't be yourself and you feel like you're constantly being judged by your mentors, by patients, by other members of staff, that's going to create a huge amount of stress and influence their well-being. There was also the organisation of the course came up again and again, both in my interviews and in the questionnaire. So students recognised that being within the 2 different areas, so being in the university and within practice, can be a good way to learn, but they were telling me that it was full on and could be exhausting. And this had 4 key parts to it. So firstly, the expectations that were placed on students. So they were saying that they felt they were expected to be inhuman. So this was things like feeling they weren't allowed to be affected by the really intense components of the course. Like when they sought help, it was kind of like, this is what you signed up for, you should just get on with it. It was also the amount of work they felt that there just was too much for them to cope with, and that this was inhuman. They were saying the communication was really poor. So this was things such as they were finding out their placements 3 days before the start date. And I spoke to a mother who had 4 children, and she was saying it just doesn't work in terms of organising childcare. It was a huge form of stress. And this was like the academic practice split. So some students saying they had academic assignments whilst they were working full time in the practice setting. And linked to this was some students also having to have part-time jobs because they weren't financially able to not work. And so the lack of communication in terms of the arrangements of their course and the difficulty they had in terms of managing the workload, in addition to this need to get extra support, and then feeling this couldn't impact them, that they had to just get on with it. I think that kind of shows the amount of students are under and how an impact that might have on their well-being. The final theme was support. So given the points I've just made about identity and organisation, if support was there, that might have helped to offset some of the impact. However, the students felt that they were left with minimal support, feeling overwhelmed by the expectations. So this related to help seeking. A lot of students referred to feeling frightened to say how they really felt, and that when they did seek help, the support provided just wasn't sufficient. So that might be people not replying to emails or only being offered 6 sessions of counselling. Another student commented on the fact that when their friend had sought help because they'd seen a cardiac arrest in a practice setting and it had been quite traumatic, and the student felt that they were to blame in some ways, the university pulled them out of an intense environment and put them in a less intense environment. However, they didn't help them to cope with it. So that student was then left feeling, well, I can't be a nurse because they just feel like I can't cope with the intensity of it. Rather than giving them support to process those feelings and to look at how they could learn from them. I did feel it important to include 2 themes that came out of the academic and educator interviews. So I am very aware that the people I spoke to were probably biased, because people who are willing to give me their time to speak to me were most likely quite in favour of supporting students well. And the impression they gave me was quite different from the impression students gave me. However, they both said that they felt there should be a flourishing environment. So rather than focusing on ticking off students' competencies, they felt student nurse education should be about ensuring students flourish and that they enjoy their experience and that they feel supported. And a part of this was educating the educators, so ensuring that they are well equipped to be supervisors and mentors and are well equipped to ensure that students feel supported and that they're able to create this flourishing environment. So I think those 3 themes have kind of shown some of the real key issues student nurse specifically are facing, in addition to all of the pressures we know students generally face. So I have created 3 interventions to try and overcome some of these difficulties. And by intervention, I mean anything that's going to intervene. So it's not necessarily something like mindfulness. It is creating realist informed logic models that can help people understand how some of the factors are influencing the well-being of students. But one of my key interventions is a checklist for student wellbeing. And I'm very proud because I've created an acronym called the culture. So each letter stands for something that influences wellbeing. So that might be time, that might be the expectations, that might be homework balance or a culture of openness. And the idea is that people can use this to really think about how they are supporting students, which is all based on the findings that I have found in my research. I'm also commenting on the student nurse education guidelines. So this is a form of policy advising. So the Nursing and Midwifery Council, who are the governing body who oversee nursing and student nurse education, create guidelines to that universities have to abide by in order to be providing a form of student nurse education. And so I felt like if I targeted that level, hopefully that would then filter down into most of the university settings. And then, like I said, I've created realist informed logic models which connect each of the points within the culture to student wellbeing to show why I think we need to target it and how an intervention might be able to have an effect. I'm very aware of time, and this has been quite the whistle-stop tour of my research. But if there's anything in particular you'd like to know more about, or if there is anything that I have briskly spoken about, please feel free to ask questions. I am going to stop sharing my screen because it's quite disconcerting not being able to see anybody. But there we go.
Becky, thank you so much for such an excellent presentation, and you've done so much work. I'm really impressed by everything you've done. It's really helpful, and I always love hearing about theory and stuff too, so I particularly enjoyed that. Does anybody want to kind of kick us off with any questions for Becky at all? Tom, we'll come to you first, please.
Yeah, thanks very much, Becky. That was fantastic. I was wondering what your understanding was. Oh, sorry, I was wondering whether there had been anything done similarly in other healthcare professional degrees or allied health professional degrees or medicine or anything like that.
So yeah, there is a lot of different approaches, I suppose, and so I guess there are similarities between the approach I've taken to other degrees. However, I think quite a few of them have either focused specifically on stakeholder involvement and almost ignored theory, or they focused on the evidence and ignored including stakeholders throughout. I mean, my plan was to include people a lot more within my work, but COVID unfortunately changed the way student nurse education was run, which then meant that it was quite difficult for me to get a sample. But I am in contact with some people who do look at medical based education and also physiotherapy. And there are some crossovers, but I think what is kind of unique about my PhD is trying to incorporate all different three components, and then I'm now gaining feedback on my intervention prior to even implementing it to try and make sure that it actually is meeting the needs of those it's designed to serve.
I love your methodology. It's fantastic. It really does work. So, thank you.
Thank you very much. Any questions from anyone else at all? Ellie, we'll come to you, please.
Hi, Becky. Thanks. That was so interesting. And I actually work part-time as a specialist mentor with university students with mental health issues and autism. So this was really sort of, it was really relevant, because I have to say, when a student tells me that they're doing the student nursing course, I sort of take a deep breath because I think, because so many students sort of report all of the pressures that you've sort of spoke about with, the academic and placement split. But I've also found that a lot of sort of the nursing professionals haven't always got a positive attitude towards supporting students with mental health issues. Was that something that you'd picked up as well?
Yeah, definitely. So actually the two students I interviewed, they both disclosed quite severe mental health difficulties, I suppose, where they needed quite intense support to get them through, and they felt that the university didn't really understand that. So for example, when they were giving extensions, they were only given 2 weeks, and they were saying they just changed their medication and they were going through a really tough time, and really 2 weeks isn't enough time to do that. And other students were saying in terms of when they sought help from the university, I think I brought this up last week, they were only offered 6 counselling sessions, and they said that that just was not sufficient. And I think I've seen so much in my time as a student nurse. I can't count how many difficult experiences I have seen, and I was really lucky that my mentors always sort of debriefed me. But for some students, they're not offered that, and so if they're put in a situation where they're struggling personally due to perhaps mental health difficulties or other stresses, and then you're in the practice setting and you might be facing the things, you're trying to support people who are experiencing what you're experiencing, and then the university either say get on with it, or they don't reply to an email, or they give them 6 sessions, it's quite easy to see how the students do feel neglected.
Sorry, my microphone was muted then. I think recently there was a student that had said that they'd met with their personal tutor and they'd got a reasonable adjustment sheet which outlined all of the support that they needed and the adjustments that needed to be put into place. But I think one of their tutors had said, oh, it doesn't apply because you're a nursing student, so reasonable adjustments don't apply, which just isn't, that's not
No.
true, is it?
And
it's not okay.
No, and I think that's really difficult as well, because when you go into placement, your roster is done for you, so you don't really get any say as to when you're working. And so if there are reasonable adjustments, it can be really difficult to advocate for yourself, because sometimes the staff in practice kind of just see you as soft, I guess. Like I, for my own health reasons, couldn't do night shifts, and when I tried them, they just didn't work for me. But I found myself constantly having to justify why I wasn't able to do night shifts when I'd already had my reasonable adjustment put in place, because I was able to do long days. I could do any other shift, just not those. And I think that's what's really difficult, is that you're moving. So I had 10 placements over 4 years, and you're moving between all these different areas. It's like starting a new job every single time. And if you're having to explain why you have a certain reasonable adjustment, it's really tiring. So it's a lot better if there could be, I suppose, better communication between the two settings. And that is something that's come out of my PhD, is that they really need to be talking to each other more in order to make sure that students don't fall through the gap, or they're not expected to keep on explaining their life story as to why they can't do a particular thing on placement.
I'm so pleased that you're doing this project, Becky. It sounds absolutely amazing. I look forward to hearing more sort of the outcomes.
Thank you very much.
Thank you.
Yeah, I'd echo that. Sounds like really great work. Anybody else want to come in at this point with any questions for Becky at all? I might just, we'll go to Sally first, please.
Hi, Becky, that was great. That was you really articulated that clearly, the whole process. I really appreciated hearing that kind of from start to finish. It's really, really clear. And my background's in education, and I just feel like there's so many parallels, the challenges that the student nurses face with the professional standards and the academic standards being presented at the same time, and each individual teaching placement is a different setting. So I just wondered whether you were aware of any anything in those fields, because it sounds like there might be kind of, in terms of the principles, that a transferability there, which would go into other contexts. I mean, obviously in other health areas like speech and language therapists or physiotherapists, that might be easier to share, but it seems like it's got huge potential for practical dissemination across other professional courses.
Yeah, definitely. I've because at Winchester there's quite a big teaching faculty here. They're quite good on primary education. So I have been looking at how some of the findings from my PhD could apply to, for example, teaching, like you've suggested. There has been similar research in teaching, but again, nobody has taken, that I've come across, such a broad approach. But there's also things, for example, veterinary students have quite a high rate of mental health difficulties. So I'm looking at how my findings might be applied to them. And also there's other courses, so even like master's courses. So as a nurse, you have to do something called continuing professional development. And so often you're still trying to learn at the same time as doing ridiculous shifts. So I think it's not just for undergraduates, I think it's for master's students as well. So yeah, that's a really great point, in that I'm trying to make sure that my findings go broader. And I also think that the idea of identity has huge implications for most people, because the concept of authenticity and not being able to be yourself, I think within academia, that's quite rife. People sort of feel the need to put on a mask or to not be who they are. And so there definitely are human things that aren't just specific to student nurses, because I think like people sometimes see health professionals as being superhuman, or I think the hero narrative isn't always helpful, because at the end of the day, you might have a 19-year-old who experiences really difficult things on placement, and they are just a 19-year-old. And I think so often we lose sight of that. So yeah, definitely transferability to a whole range of areas.
Yeah, good luck with that. That's there.
Thank you.
Articulated it so clearly. I'm sure you're not going to have any problems disseminating it wide, Becky. It was great. Thank you for sharing.
Thank you.
Excellent, thank you. Tom, I think your hand's gone back up, so we'll come to you, please.
Yeah, I think it's more of a comment, and going back to what Sally mentioned about transferability. So I support the social work apprenticeship module at the University of Lincoln in School of Health and Social Care. Not my area of remit, largely more covering for staff illnesses at the moment, but I can see how like our students have 3 days in placement. They have 1 day timetable at the university, and then have a day of study day, where they can obviously have tutorials and all sorts of things. But I can just see the similarities of some of the things you've discussed earlier, translating into even things like apprenticeships as well. So
yeah, that's really interesting to know as well, the different ways of doing it. For example, students are often, student nurses are blocked, so they'll spend sort of 10 weeks in practice and then 10 weeks in university. And some of the students just say they prefer it to be more integrated, because you go from being able to wake up at 9 a.m. and roll out for an hour lecture to then being back to doing long days where you're up at 5 a.m. and travelling for hours. And there's learning that can be taken from that, including social teaching placements.
yeah, absolutely. Thank you very much.
Excellent, thank you. Ellie, your hand's still up. Can I just check, is that from before, or would you like to come in again? I will guess that that's probably up from before. I'll just ask a very quick question, Becky. Could you possibly share the title of your recently published paper? I'd be really interested to go and check it out.
Yeah, I can indeed. I think Smartin kindly shared it as well, so the direct link should be on their Twitter, but I will just get the title.
Sorry, it was a legacy hand. I couldn't get back onto Teams because I was typing an email, so sorry.
No worries at all, that's fine. And Joe's just popped in the chat that she can email it round later if that's
Oh,
easier.
okay, excellent.
Yeah, sorry, just
I
haven't come across this yet, so I'd be really interested to check it out. Can I also just ask, what are the kind of plans for the next steps for the kind of evaluation of the interventions that you've designed, and what's the kind of timeline looking like for that next phase?
So I have now created the culture, which is just being evaluated at the moment via a questionnaire. My response rate is currently quite low, so I just need to boost that and try and get more people to feed back to me. And then I am hoping to publish so that I can share my findings. And then I'm also hoping to do some form of policy advising. So thankfully, one of my friends is a policy advisor at UCL, so she's sort of helping me work out how I can make this the findings applicable and acceptable to people who are in the real power seats who can influence this. So timeline-wise, I'm due to submit my PhD in May. That's the aim, and I'm currently on track for that. And then there is some talk about potentially getting funding to evaluate the use of my different interventions and to see how I can explore that further. But as with anything, it's kind of waiting to find the right pot of money to support me in this. But yeah, I am really hoping to publish quite a few different papers out of my PhD. For example, my definition of well-being. I've got a paper on authenticity that I'm working on. I've also got my case study findings. So yeah, hopefully over the next period of time, you'll be hearing a lot more from me in terms of what I found out.
Excellent. I really look forward to it. And just from my end too, I'd be really interested to hear about your experiences of the kind of policy advising end of it. So whether you want to come back to present to this group, maybe once you've kind of had a chance, or whether that's something that you publish, I think that'll be something that'll be really useful for lots of people that are kind of interested in that area, and exploring kind of what you were saying about how to make kind of the work that you've done kind of applicable to policymakers.
Yeah, absolutely.
Excellent, fantastic. I think you can see, yeah, you obviously can see the chat because you've typed in it, but you're just getting lots of thank yous for a great presentation. Jen's asked a question in the chat, which we'll come to next. I was wondering about the pressure the students felt around expectations. Was this expectation to cope mentally, and was this primarily from the university lecturers or from themselves?
So the expectations, I think, came from multiple different areas. So there was some from the university lecturers and from their mentors in practice. So, for example, if I think when they went to people and said, "I'm struggling with the workload," it was kind of like, get on with it, which they took to be by this workload, like this is the expectation of you, and they were saying, but I can't cope, and there wasn't really any response to that. But I also think it's the wider societal perspective as to what a nurse or a student nurse is. So this is something I'm publishing on in terms of the professional identity as a student nurse. So when you start your student nurse course, you're given a lecture, and it's sort of talking about how you behave both in your personal lives and in your professional lives, because we have to, so I'm a registered nurse, which means I've got a code of conduct that I have to abide by, and you can technically be struck off if you deviate from that. But some of the examples that are given of deviating from that is uploading photographs of yourself drinking alcohol on social media. And some of the students were saying it's really difficult when you're a fresher because you might be out with your friends and everyone's uploading these photos, and how on earth are you meant to police that? And I think to them, they were taking it very literally, whereas there's slightly more nuance to it. And so I think to them, they sort of felt like they could never switch off because they were constantly thinking in their personal lives, well, am I going to be struck off because I went out and had a beer with my mates and someone put a photo of me on social media? Which actually, as I'm a patient myself, and I wouldn't mind if a nurse had gone out for a beer with their mates to unwind. It doesn't influence their practice on placement. Fair enough, there are some things you do in your personal life that would. I'm not saying there isn't, but I just think the expectations aren't always that clear on students. They're just given a lecture rather than having a seminar where you could really discuss this. So one of my areas of supposed expertise due to my master's is ethical decision making. That's something I lecture on. And the way I'm teaching that is through more of a seminar approach, so we can talk about it. And one of the suggestions I've given is that we talk about expectations with students in a problem-based way. So it's kind of saying, this is a scenario, what do you think about this? Rather than saying, never upload a picture of yourself on social media, and students being like, oh no, like what am I allowed to do? So yeah, that was a very long-winded way of saying I think the expectations are broad and deep in terms of the pressures students face.
Excellent, thank you, and definitely makes sense as an approach because, as you say, kind of lots of expectations and decision-making stuff is very context-specific, and the best way to kind of address that is through kind of discussion. I sometimes, as an aside, think this would be a bit more of a way forward for kind of for training of like academic staff and things, being able to develop a bit more of a context specific way of supporting students rather than just, as you say, kind of a list of do's and don'ts, which can sometimes be difficult to apply. Sally, I think your hand's come back up, so we'll come back to you, please.
Hi, Becky. I just wanted to pick up on something that you said about your definition of wellbeing, that you're planning to publish something on the definition of wellbeing. And I just wondered, you were talking about stress and alleviating stress. And I just wondered if you'd talk a little bit about how you got from definitions of wellbeing and through your themes, because, yeah, how you got to be talking about stress. Would that be all right?
I'm very glad. Yeah, I'm very glad you've asked this question because I love justifying this. So yeah, top marks for the question. So basically, there is a whole host of literature on student nurse wellbeing, and people tackle it from the concept of resilience, from mental health, from mental wellbeing. I think these are things you perhaps are all very familiar with before from your own areas of research. And so the first issue is a very pragmatic one. I could not do a systematic review of all of the out there that could be connected to well-being in some way. And because many authors actually had a definition of the concepts they're saying, it was very hard to know whether they were studying well-being or they were studying resilience, or whether they're the same thing, or even their participants interpreted it was quite difficult for me practically. So came up again and again and again in the literature. So I thought, great, that would be a good place to start. However, the other reason I went, oh, sorry, we lost connection. I'll go back a bit. Someone's just lost connection, so they've asked if I can repeat. I was essentially saying there's been a lot of different approaches to well-being as a concept, and because people weren't defining it, it was really difficult for them to difficult for me to be able to interpret the literature and the evidence in a way that would be valid, I suppose, because of the lack of definition. So I had to sort of choose one specific concept to really hone in on, and stress was something that came up in some stakeholder initial groups I did, because before I even started my PhD method, I'd already spoken to some stakeholders, and it also came up in quite a lot of literature and theory. The other key reason I chose stress was because when I was looking at well-being, it was a lot was to do with the balance between the challenges an individual faces and the resources available to them. So that comes from Dodge. And to me, I found myself really grappling with this because I felt well-being went beyond pure balance. But if you read Dodge's paper in depth, it really explores what the difference between a definition and a description. And so essentially, I started with the concept of well-being, and then for both theoretical and pragmatic reasons, decided to hone in on stress for my systematic review.
So do you use well-being in your title?
For my thesis, yes, and I've created a definition, and I apply my stress literature not directly, but I link it through the definition I've created, if that makes sense.
Okay, so you provided your justification for using stress as the key aspect of well-being that you were going to focus on through your work.
Yeah.
Okay, because it is a minefield, isn't it? I mean, my research is around well-being, and yeah, you begin by thinking, oh yeah, I'll define well-being. Let me read what's said about well-being, and then like, oh, it just unravels from there, doesn't it? So, oh, well done for finding a clear way through. Excellent. Thank you.
Well, yeah, I also think people were talking about resilience as if it was well-being. And then I was like, I can't exclude papers on resilience when I'm looking at interventions to improve well-being, because they're using a definition of well-being for resilience. And it got very complicated, whereas stress was a bit more, I'm quite keen on ensuring I'm measuring what I'm intending to measure, and stress produced that for me. So
is a reduction in stress necessarily an increase in well-being?
I personally, I haven't got much data on this. I don't necessarily think it's as, what's the word, binary as that perhaps. I think it's slightly reducing stress and increasing resources is what is needed for well-being. And so I think reducing stress, yes, that could increase well-being for some people. But I also think that, like with most things, it's very nuanced, and that's what the students were telling me, that a lot of people focus on them and their resources and their resilience, and they were saying, but it's too much stress, I can't cope. So you could increase my resources up here, but if stress is pushing me down here, it's not going to help.
Brilliant, thank you.
Yeah, thank you very much. Really, really clear justification. Yeah, we've got on really well with your connection, Becky, but it cut out for a second there. If it cuts out again, I might just be rude and just let you know that we're struggling to hear you. Perhaps you could try with your camera off or something. But yeah, so far we've been so good. We have a question from Helen in the chat, which you could probably see, just saying that really fascinating and important work. Do you have any further information about the logic models you're producing, what they are, what they involve, etc.?
So I do, but I don't want to overwhelm you all, because I overwhelmed my supervisors the first time I presented these, and so I don't want anyone to feel like they can't access what I'm saying. So I'll try and do it very simply. So essentially, I've taken a realist approach. So I've created context, mechanism, and outcome configurations is what it's called, and it's essentially then and if statements. So for example, like, or if and then statements. Sorry. So if students feel they can be themselves on placement, perceived authenticity will increase, and then well-being will increase. However, I've done that through a more of a context, mechanism, and outcome setting. So I've said this is the context in which I would be working in, and then this is the mechanism I'm imagining it would have an impact through, because my systematic review I've not really gone into because it's quite complicated, but behaviour
Sorry,
change
Becky,
techniques and I change behaviour. So it's things that
you're breaking up a little bit again.
I'll try turning my camera off.
Okay, great. Thanks. Sorry.
Is that any better?
Yeah, that sounds a bit clearer. Thank you.
Okay, good old EduRoam. Sorry, everyone. Yeah, so I basically created diagrams that connect the context to the mechanism to the outcome, and my mechanisms are going to be as small as I can make them. So rather than making very broad statements, like I did with systematic review, but I was looking at the precise technique used to try and change behaviour. Can you still hear me? Are we all good?
Yeah, we're all good. Yeah.
We're all good. Okay, fab. Yeah, so I'm trying to go very deep level. I've forgotten what I was saying, but I hope that answers the question.
Yeah, that's really helpful. It's very difficult to answer a question when you've got somebody like me that keeps cutting across you saying that we can't hear you. But yeah, that's a good introductory account of your logic models. I personally would be really interested to find out more. Was that something that you were planning to publish on?
Yes, I'm actually waiting for my final viva, because I have one of the most prominent people within the field, very, very, very luckily, as my examiner, and we are hoping she might want to publish with me, and she's done a lot of realist reviews in this area. So yes, it won't be until next year, but I am definitely hoping to get them out there.
Oh, exciting. I'd be really interested to find out more. Great, fantastic. We've probably got time for one more question if anybody wants to come in with any final thoughts or reflections for Becky at all. I think we might all be questioned out. I might just ask another very quick question. I'm not sure whether you addressed this at the start of your presentation, so I really do apologise if you did. I might have missed it. But what's the evidence base for nursing student wellbeing relative to the kind of the general population? And I'm also wondering about whether there's an evidence base around COVID, because there's kind of evidence to suggest that student wellbeing deteriorated during the start of the COVID pandemic. And is there evidence to suggest that this was kind of a greater challenge for nursing students, given some of the contextual situation that they were placed in? If that makes sense.
Yeah, absolutely. So like with a lot of research areas, there isn't great research comparing to population norms, but what we can compare is the attrition rate of student nurses to other programs. So even in other healthcare programs, you're looking at 5%, and you call that necessary attrition. So that might be people who fail the course, leave for personal reasons, realise it's not for them. So you're never going to get no attrition, but 35% is incredibly high. And indirectly, you can see how that relates to wellbeing. So when you look at the reasons for leaving, stress and problems with mental health and personal difficulties are rated quite highly. So I am asking for more evidence to compare student nurses to population norms, but there isn't much research out there. In terms of COVID, we know that student nurse wellbeing anecdotally was impacted. There is some evidence now coming out that shows this in a more objective format. However, I really think the qualitative work is what we need to look at for this area, because there's only so much a measure can tell us, whereas student nurses giving us their own experiences can be really beneficial. And it was an incredibly diverse experience. So first year students were removed from practice, they weren't allowed to go in, whereas third year nurses became paid members of staff. I don't know if people were aware of that. So they were, when you register as a nurse, you're something called band 5. So band 5 is the registrant level, and student nurses were paid at band 4, so just below that level. And so obviously they went from not having to be members within the numbers, they were supernumerary, to being in the numbers, and there wasn't always clear guidance as to what their specific role is. So then that was huge nurses are now having to catch up all those practice hours that they missed out on because of COVID. And yeah, Tom said about the same with doctor students. They I think they graduated early, didn't they? And they all got thrown out into there, and obviously that creates stress. So I think this is going to be a very nuanced thing, and I think we need to look at year group specific. We need qualitative research to really unpick what happened during COVID.
Excellent, thank you very much. That's a really helpful answer, and I guess in the context of your work, specifically some of the theoretical models that you've been exploring and some of the methodology, I guess this kind of provides a good example of some of the way that we can start to develop that, to think about what interventions might be effective going forward to kind of support nursing students' well-being. Excellent, fantastic. Well, thank you so much. Yeah, I'll just say again on behalf of the group, that was a really, really excellent presentation. I'm really impressed by all the work that you've done, and excited to see to read more about some of your work as it comes out. Thank you to everybody for your participation and questions. We're going to be in the same place, same time next week, where we'll be joined by Zoe Mills from the University of Lincoln, who's going to be talking about an Office for Students funded project on transitioning students effectively to support their mental health. So please do come along for that if that sounds of interest. Otherwise, I will just struggling to get the chat up, but I will just close by saying another huge thank you to Becky, and enjoy the rest of your day and week, everyone. Catch up with you later.
Thanks, Becky.
Thank you everyone for having me.
Fantastic, well done.
It's been great to have all the questions, so thank you.
Thank you.